Is learning the English language your toughest challenge yet? Become our student and get access to effective and free educational materials.
What's the problem?
I have a laceration on my left forearm.
Let me have a look. How did this happen?
I got hit by a car in an accident.
Was there much bleeding afterward?
No, not much.
Well, this doesn't look too serious. Nurse, could you please get me a suture set?
Will I need stitches?
Yes. 3, I think. It won't be too painful. Alright, we're done. That wasn't so bad, was it?
No, not really.
You're lucky there was no lasting damage. I'll set up an appointment for you to come back in 5 days. We'll take those stitches out then. So long.
Thank you, doctor. Bye.
Hi. The lab said that you would be getting my test results in today.
I'd like you to come in and discuss some further tests that I would like to run.
I think that this is a bad sign.
For now, I would like to run a few more tests to look into some of the problems that you mentioned.
Why wouldn't you tell me over the phone?
If there is any question about test results, we always do a recheck.
I need to come in right away.
I would be happy to see you this afternoon. If you are feeling upset, please bring a friend or relative along.
You are scaring me.
Come on in this afternoon and we will talk. It will be fine.
Has everything been okay with you lately?
I haven't been able to get a good night's sleep lately. I'm exhausted.
Have you been too busy to get enough sleep?
I try to go to sleep, but I just can't stay asleep.
How late do you try to go to sleep?
I go to bed when I finish my work.
Has anything in your day-to-day life been bothering you lately?
I am worried about how I am going to pay my tuition.
You might consider listening to relaxing music as you go to sleep to clear your head.
Doing something relaxing before I go to sleep sounds like a plan.
I have a terrible toothache.
Which tooth is it?
This one here.
Yes, there's a big cavity.
Can you feel it?
I'm afraid not. The tooth is too far gone. It'll have to be taken out.
Then I might as well have it done now.
You'd better wait. The gums are swollen. Take the medicine I prescribe and come back in 3 days.
I have a terrible toothache.
Which tooth is it?
Pointing. This one here.
Yes. There's big cavity.
Can you feel it?
I'm afraid not. The tooth is too far gone. It'll have to be taken out.
Then I might as well have it out now.
You'd better wait. The gums are swollen. Take the medicine I prescribe and come back in 3 days.
Good afternoon, Chloe. I'm Dr. Evans. What seems to be the problem?
Hi, Dr. Evans. Thanks for seeing me on such short notice. When I woke up this morning, I had a really sore throat and a really bad cough. I think I am coming down with the flu.
I see. Yes, you do sound rather croaky. Well, let's have a look, shall we? Could you please open your mouth and say, ah?
Ah.
Good. Yes, your tonsils are a little swollen and red. How are your ears, blocked at all?
A little actually. My sinuses are a little blocked up as well. I really feel terrible.
Okay, Chloe. Can you please breathe in and out slowly for me while I listen to your chest? You really are all bunged up. You don't sound too good at all. Okay. I'm going to set you up with a bunch of antibiotics. You will need to take these orange pills twice a day and these blue pills every evening. You will also have to take this cough medicine 3 times a day after meals. Finally, I am giving you an inhaler to use every time you feel breathless just to clear up your lungs.
Whoa, so many drugs. I hate swallowing pills. Am I able to go to work?
Absolutely not. You are highly contagious. You don't want to infect the rest of your coworkers, do you? I recommend staying in bed for at least 3 days and drinking plenty of fluids so you don't get weak and dehydrated. You can catch up on all the latest TV shows and movies.
Okay, would you mind writing me a doctor's note for work? Otherwise they may think I am faking it.
Ha ha. Sure, not a problem. Here you are. Now off you go and away to bed. If you have any questions, just give me a call. Feel better soon and take care.
Thanks, Doc. Bye.
How have you been doing?
I can't sleep or eat. I have a really bad pain in my tooth.
How long have you had this toothache?
It bothers me off and on, but it's gotten much worse these past few weeks.
Is there anything that you've done to your tooth that might have caused the pain?
My girlfriend told me that I grind my teeth a lot when I sleep. Maybe that is the problem.
When you brush your teeth, what do you use?
I use a soft bristle toothbrush.
Does it bother you when you have to chew a lot?
Absolutely. That set it off big time.
Dr. Ruth's office, may I help you?
Yes, I'd like to make an appointment to see the doctor. My name is Randy Horn.
Let's see, Mr. Horn, the doctor's schedule is full today. Would tomorrow be all right?
Yeah, I guess I can survive until tomorrow.
Would you prefer to come in the morning or the afternoon?
In the morning, if possible.
The doctor has an opening at 10:30 tomorrow. I'll put you down for then.
That would be fine.
Okay, Mr. Horn, see you tomorrow at 10:30. What's the matter with my wife?
She had a sudden heart attack.
I guess so. It was very terrible when she was at the onset of the illness. I am worried that I would lose her.
Don't worry. She is much better now. But you are not permitted to disturb her at the moment.
I know, but is she out of danger now?
Yes, I think so.
Thank you very much, doctor.
My pleasure. Good morning. What can I do for you?
Good morning. I have a bad cough, and I want to see an internist.
Do you have a registration card?
No, I don't. I'm a tourist.
Then you need to register as a new patient. Can I have a look at your ID card? I need your name, age, occupation, address and contacting number.
Here you are.
Thanks. Which kind of medicine do you prefer, Western medicine or traditional Chinese medicine?
I'd like to try traditional Chinese medicine. I heard it really works quite well if you know what you're doing.
All right, yes, he does. The registration fee is 7 yuan, please. Please point out the painful place with your finger. Is there any relation between the pain and the weather?
Yes, the pain comes more intense when the weather is bad. And the pain comes more intense when I walk too much.
Have you ever had any trauma?
Yes, I have.
Does the pain become more intense at night?
Yes, it does. Just like a needle prick. Besides, the place that hurts often feels cold, too.
Do you have the sensation of ants crawling over the painful part?
Yes, I do.
I'd like to treat you with acupuncture if you agree.
By the way, does acupuncture hurt?
Acupuncture may cause just a little pain, but it also causes a certain feeling of numbness and distension. We'll try it every day for 7 days. Will that be all right?
Yes. Let's start today.
Good morning. What seems to be the problem?
Good morning, doctor. I feel terrible. I've got a cold and I have a rash here on my neck. I'm not sleeping well either. What do you think the problem could be?
I'd say you've been working too hard or are under stress for some reason. Have you been taking anything for your cold?
Yes, I bought some medicine at the chemist's. I've been taking it for 3 days.
Good. I'm going to prescribe something stronger. It will make you feel drowsy, so you certainly should rest.
Okay, I can afford to take a few days off work.
Have you been working hard recently?
Yes, I have. I had to get a project finished. It's done now, so I can relax a little.
Good. Let's take a look at that rash. It looks worse than it is. I'm going to prescribe some ointment for it. If the rash doesn't clear up in a few days, come back and see me. Do you have any other sign?
I have a bad headache, but...
Don't worry about that. It's probably of the stress you've been under. Just take some aspirin. Combined with the stronger cough medicine, it will make you feel very tired. You shouldn't work or use it.
Thanks, doctor. I'll get these immediately. Goodbye.
Become our student and get access to effective and free educational materials.